Hi, I'm Maxine.
I'm Danielle.
And we're the co-founders of Otto Health. We are posting a lot of information online for folks who are interested in launching their own practice and wanting to do it themselves. And at Otto, we offer a full service solution to help clinicians launch, run, and grow their own cash pay practices. But for folks who want to do it themselves, we want to make sure that they have the information necessary in order to launch. So we've been posting these blog posts, and now we're also creating videos and audio content so that folks who learn better in these different formats all have options. Today, we're talking about methods for local patient acquisition or local marketing. In a previous video and a previous blog post, we talked about the value of local marketing, especially for early practices. And so today we're going to jump into actually how to implement a local marketing strategy. We'll discuss 4 buckets today. One is partnership and events. The second is online efforts. The third is referral and discount programs. And the fourth is less often used mediums for marketing. So let's jump in.
Awesome. So within partnerships and events, there are a bunch of different ways that you can approach this. Lots of interesting ideas, but all focused on activating your local network and the local businesses and people around you. So the first idea that we have here is to build partnerships with local businesses. And these could take a bunch of different forms. So one form could be actually directly selling to those local businesses. And what that could look like is essentially having those businesses offer your services as an employee perk for their employees. So for example, if you're a direct primary care practice, this could mean the employer provides direct primary care to their employees, either by subsidizing the membership, covering it all together, or working with you to negotiate some kind of discount. So that's idea number 1, is having some kind of financial partnership with the employer to give their employees access to your services.
Nice. Idea number 2 is to build relationships with local health and wellness providers that are offering complementary services to you.
And relatedly, idea number 3 would be working with other businesses that might not be providers, but are still tangential to what you're offering to really co-market or co-brand. So for example, if you're a healthcare clinic and there are some local gyms in the area, they might be great partners for you, either to market one another's services or even to offer some kind of combined service. And so you can reach out to those local gyms, local spas, and see if there are opportunities to grow each of your businesses independently or together.
The next one is to attend local events and health fairs. So this can be either just as a spectator, someone who's walking around, or who's having a booth. It's really common for neighborhoods to have these sorts of events. This might look like a farmer's market, or it might look like a health expo. And if you can get yourself there and get talking to people, that's a great way to meet new folks who might be interested patients.
And this is what you might have heard of referred to as networking, and sometimes calling it networking makes it seem a lot scarier or like it has to be really businessy, but the idea is, just as Maxine said, to get your name out there, to meet people, to be friendly, and just to operate the way that you would if you were talking to someone in a grocery store, you were just meeting someone on the street. How would you interact with them? You can take that same exact style of interaction to these types of events. The one thing that could be really useful to have as you attend these events is actually a business card.
You can even have a QR code so that people can easily access your website. So that's kind of a fun, nice addition. But to Danielle's point, just being really genuine and authentic in your communication with folks, if you do attend events, will make it feel probably less challenging for you and probably land better with the folks that you're talking to as well.
And the next idea that we have is to host small events or workshops. So beyond just attending events that others are putting on, you can put on your own events. And this could be in your space if you have a physical space. It could be in a gym if you have one of those partnerships. You could rent out a space. There are lots of different options. And this could be a way for you to really do the one-to-many selling and to get your name out there to a large group of people. You could do this on a topic that you have a lot of expertise in. It could be an area for people to just get together and chat about things that they're interested in. Lots of different themes that you could employ. But the idea would be to get a lot of people together and to have a group that you could really share more about yourself and your practice.
Totally. I think to Danielle's point, if it feels like it might be a big ask for you to go and present on a topic that you feel really knowledgeable about, or maybe you feel some amount of imposter syndrome with that, just being a knowledgeable voice in a room who's facilitating maybe some kind of discussion can be another format that works really well for these kinds of events that also then makes it feel less pressureful on you to be the domain expert. The other thing is you are an expert, you're a provider, you have a bunch of education, and even if you're not able to answer every single question that comes up, if you are being the expert voice in something, having a sense of where you would go look or how you could answer that question is good enough for you to be comfortable hosting these kinds of events. So don't let any sort of imposter syndrome keep you from trying that method if it speaks to you otherwise.
And the last thing to consider there is actually, as you think about events, workshops, they don't actually have to be in person. So you could also do webinars over Zoom or over some kind of video conferencing platform so that you don't have to worry about that physical space component.
Totally. As one example or one anecdote, we know a clinician who will sometimes use Facebook Live as a method for that. So you still get the sense of liveness, but it's a one-way thing, and it's a technology that people feel really comfortable with. So it can be Zoom, it can be Facebook, it can be another technology if you prefer to be virtual. The next idea is to get involved in this partnership and events bucket is to get involved with your local chamber of commerce or business association. So something that not that many people know about or is maybe less commonly talked about unless you're a business owner in a community is that chamber of commerce organizations can be super valuable networking and resource groups for business owners in an area. So often chambers of commerce will have events, they'll have meetings, and you can go and share more about your business, meet other local business people, and possibly connect with potential patients. So that can be a really high leverage group to get access to.
And the last idea that we'll call out in this bucket, and of course this isn't to say that there are no other ideas in the partnership space, there definitely are, but the last one that we see quite commonly used is to partner with local influencers or community folks. And what this could look like is to reach out to someone that's known for, let's say, putting together a bulletin that summarizes the events that are going on in the area over the next week, and to see if you could find ways to distribute your services through them.
Totally. This is another one that also might lend itself pretty well to a digital format. If you know someone who's well known in your community online, there might be a really great way for you all to get in touch and you to share a little bit more using their platform if your platform is smaller than theirs online. That actually leads us quite nicely into our second bucket, which is online efforts. So one idea in that bucket is to leverage local online platforms. So the idea here is that you're picking a social media platform where you are going to be relating with folks who are in the area near you. Some examples of this might be Nextdoor, which is an app that's built for neighborhoods, or Facebook groups where you're joining Facebook groups that are specific to the area you're in. This will make it way easier for you to meet folks and connect with folks who are in your area.
The next idea is to optimize for SEO, and in particular local SEO, and this is a meaty topic. I guess I'll first just define SEO. SEO is search engine optimization, and this is essentially whether you appear highly in the search results when someone Googles for your services. So for example, if someone searches weight loss near me or weight loss Orlando, Florida, would you be one of the results that comes up early on? And again, this is a big topic. We'll probably do another video on this topic alone, but the two trailheads that I'll leave you with is, first of all, content creation. So writing blog posts, putting together videos, and posting them on your website could make a really big difference. And then the second piece is your Google My Business listing, which is your business profile through Google. Definitely worth claiming that and optimizing that. There are lots of ways to do that, and we'll explain that in a future video, but make sure to be aware of those two pieces.
One more idea that we'll throw out in the online bucket is to create hyperlocal content online. So beyond the benefits for search engine optimization or SEO, as Danielle was just explaining, it can also be really beneficial for you just to become a go-to resource for folks in your area. So let's say you live in a place where Lyme disease is really common and you have a provider background. So you could write a really interesting piece about Lyme disease in your area, how to prevent it, how to spot it, how to handle it, and really become a local expert in that topic. So that's a really good way for you to get your name out there and get prospective patients hearing about you.
And then the next big bucket is activating referrals and maybe even putting together a discount program. And the first idea that we have here is to collect and highlight local testimonials. And this can take a few different forms. So first, we just touched on your Google My Business listing. It's really valuable to have patient reviews on there. That's something that plays a really big role in terms of how highly your profile is ranked when someone searches. So make sure that you're collecting those reviews and also putting them, having your patients put them on your Google My Business listing. And then beyond that, once you have those reviews, make sure that you're using those reviews in your marketing collateral. So have them on your website. If you have a flyer, add them there. Make sure that people know that there's a face and that there are stories behind your practice too.
You should think about video testimonials or testimonials from patients, written or video, as a virtual referral, basically. So if someone is talking to someone else in person and they give that referral, that's one way to do it. But if you see a face of a neighbor that you know or that you know of on someone's website, that is a really powerful way to get referred. And even if you don't know the face or the name of the person that you're seeing, the fact that a real person is talking about the value of the services for them is just such a powerful referral. Another idea in this bucket is to offer special promotions for local residents. So maybe for folks who are really close by, you could offer a home visit consultation for a first or a second appointment, something that really is beneficial to people who are in the area that you're targeting and that's uniquely beneficial for them that other folks might not have access to, can really incentivize them to use your services.
And the last thing that we'll mention in this bucket is actual structured programs for incentivizing referrals. And this can look like a refer a friend program. So if you refer one of your friends, get $100 or something along those lines. Those absolutely can be used, but there are different regulations that you need to be mindful of and lots of questions in terms of the actual application in a healthcare context. So no need to shy away from those entirely, but do be mindful that there are questions to answer before you can actually launch one of those programs.
The next bucket that we'll talk about is less often used mediums. One example of that, direct mail campaigns. The way that direct mail campaigns work is it's put on through the USPS and you can target a zip code to send out flyers to. And so if you've ever gotten something like a Fresh Direct promotion in your mailbox, that might be through something like direct mail campaigns. These are really cost-effective ways for you to get the word out in a small area about the thing that you're offering.
And although these might be higher expense initially, to Maxine's point, they do have pretty good conversions. We'd recommend starting with a smaller sample so that you're not overspending and seeing how that plays out for you. But we've seen a lot of clinics actually have this strategy employed very successfully.
The other thing that I'll add there is there are some interesting things that you can do with technology to figure out who's actually engaged with your information. So if you look into QR code technologies, short link technologies, things along those lines, that can be really helpful for direct mail campaigns to get a sense of how much engagement you're getting.
The next idea that we have here is local media, local publicity. And what this would look like is brainstorming a list of local news channels. This could be local radios, local TV channels, local newspapers, local magazines, and reaching out to them to see if they'd be interested in doing a spotlight on you and your practice. Your practice is a new innovative model that's in town, and there could be a reporter there that's really interested in using that to tell their followers more about something that's happening in the community. So definitely don't hesitate to reach out and see if there's interest in doing some kind of content around you.
The other thing there is even if a certain publication isn't necessarily super excited about covering your practice opening for one reason or another, you can still be a local health expert that they refer to. And then if you're getting quoted and you're getting maybe photos or information about you shared in a publication, the likelihood that folks are then going to recognize your name if they see something else or if they encounter your practice in another way is far higher. So just getting your name out there in ways that are maybe less obvious through local publicity can be super valuable.
And you might even offer to write a post for them on a topic that you're really expert in, and that could be a great way for them to have more content to share as well.
Absolutely. And this goes back to the previous thing we were talking about creating content online. So if you have a small repository of examples, then you can really go for folks who might not be so certain about whether or not they want you to write in their publication. You can say, hey, look, you can see my work already. And so it makes it a bit of an easier sell in case there's a challenging conversation otherwise. The last idea that we'll throw out in the less often used mediums bucket is starting a community health hotline or chat. So there are some regulations to just be aware of and make sure that you do your research on what you can and cannot offer in this kind of thing. But even just having a little chat bot on your website, which is have questions that are locally related about health, send them in. Then you can really bring value to your community for zero cost to them and for very little effort to you. And that's an early way to build a connection with a prospective patient before that patient might be ready to commit to your full services. We hope that these ideas are helpful. There are many more. If you want to go back and forth on some of these ideas, how to implement them, feel free to email us at info@ottohealth.io.